Of course, you will know, as many of us do know, that we are twice more likely to have a stroke than any other population group. And so it's a really important topic to be discussing and to raise awareness around this topic. Ask you, what are the main signs of stroke and who particularly is at risk?
I am Gloria Ekeng, stroke nurse consultant for Stroke Care International. The main sort of signs and symptoms for stroke, if you remember the acronym FAST, FAST, which we always use for the stroke campaign. F stands for face. Is their face drooping to one side? Can they smile? A stands for arms. Can they stretch your arms forward without one falling? S stands for speech. Is their speech slurred? And T is time to dial 999 if you recognize or notice any single one of the signs. Of course, there are other signs and symptoms that we can look for. We can also look for weakness of one side of the body, otherwise known as paralysis of either arm or leg. We can also look for incoordination. People don't coordinate very well when they have a stroke. We can also look for memory lapses. And we can also look for, there's another sign that we can look for. Sometimes somebody says to you, I was looking at something. It's like a curtain falling down my eyes, and you rub the eyes and it's gone momentarily, or they were in the supermarket and this just comes and goes. And that's what we call a transient ischemic attack. That's a warning sign that something is not quite right. So these are the things that we can be looking for as signs of stroke, or anybody who, any relative can notice any single one of these signs, not all of them, any single one of the signs. It's time for that person to just dial 999, because stroke, as you know it, is a medical emergency, and we say that time is brain.
Absolutely. Thank you, Gloria. So, given that what you've just said, there are lots of different types of strokes. So can you tell us a little bit about what those are?
Well, we start from the minor stroke, which people call TIA, which is a transient ischemic attack. I've already told you, somebody is pushing the trolley in a supermarket, and they suddenly feel that the arm is weak, or there's a tingling of the fingers, or they couldn't move their leg, or a curtain coming down, and momentarily they stop, and before you know it, within seconds, everything's gone back to normal. So that's a transient ischemic attack. It's always a warning sign that you have to check that things are not going on well. Having said that, then we have the stroke that's caused by a thrombus, by a clot that has dislodged and gone into the brain, and they blocked the blood supply to the brain. We also have the most serious one, which is a hemorrhagic stroke, which is when there's a burst artery, one of the main arteries burst in the brain. The blood has gone into the vital parts of the brain, and that causes a stroke.
And do you is that more common in Black people, that kind of stroke, the clots?
Yes, it is. All these ones that I've discussed with you right now are common, very common. Black people always also have the transient ischemic attack, because sometimes we are not the best in looking after our health. So when these transient ischemic attacks come, it is time for you to check other things like your blood pressure, like, if you're diabetic, to check that things are really working well in your body. But if you don't, then this is a warning sign. And Black people are, as you know, have these factors that predisposes them to stroke more than their white counterparts.
Sure. Yeah. Can you tell us a little bit more about those predisposing factors then? So what are the causes? You've mentioned high blood pressure. What are the other things that we need to be mindful of?
Well, we are very prone to diabetes. The Black Africans and the Asians and Caribbeans are really predisposed to having diabetes, either genetically or through our lifestyle. So diabetes is one. If it's not optimum control of diabetes, then that over a long time can predispose one to stroke. Also, this it could be genetic. It could run in the family. So taking a full family history would be very helpful. What happened to the grandparents, to the parents? Did anybody die of stroke that they know in the family? This could be very useful also. And there's some heart diseases that can predispose one to stroke. AF, for instance, atrial fibrillation can predispose one to stroke. So we need to have all these things in control or checked to make sure that we haven't got any one of them. If we do, we have to make sure that we have adequate management so that we can cut the risk of stroke.
Okay, thank you. And so what would family members, or what should family members do if they spot the signs of somebody having a stroke?
Well, I will answer that question. I also forgot to mention that in children with sickle cell anemia, stroke also, yeah. So, but we know that Africans and Caribbeans, we have this sometimes in the genes, sickle cell disease. So children, doesn't matter what age, these people are at very risk of stroke, people who have sickle cell anemia. And then your other question was, what do family members do? If you notice any single one of these signs or symptoms, because sometimes a stroke happens when somebody's asleep, and if you try to wake them up because you don't know the time, but the ones that you see that you can ascertain that it happened at this time, then you should really be calling 999 and tell the operator that this is what you've noticed. Somebody is not speaking properly, their speech is slurred, or they are drooling on one side, or their face is asymmetrical, or they're unable to move their arms, their arm is drooping, and they're unable to walk because they have lower limb weakness. You should tell exactly what you've seen or what you noticed. That will help.
So we're all about prevention. Nobody wants to have these things. So we're doing all we can to stop this from happening in the first place. So what can we do to reduce the risk of having a stroke?
So we say that in terms of risk, there are modifiable risks and non-modifiable risks. The modifiable risks are those that you can have control over, those things that you can control, say for instance, lifestyle modification, right? Eat healthy food. African food can be very healthy. It can be also be a lot, you know what I mean, So eating healthily and exercise, keep walking, keep moving those limbs, get the blood moving in the circulation. Stop smoking is another big thing. You have to stop smoking because alcohol, reduce your alcohol intake as well. These are all the things, how you can modify. These are the things that you can modify, to make your health better.